Preventing cavities with sealants. I'm Dr. Stephen Christensen. We can prevent nearly all decay that would have been present in your developing child. How? A few simple rules. 1. Diet, control of sticky sweet things, avoiding in-between meal snacks, and especially avoiding soda pop and energy drinks, which contain phosphoric acid. 2. Regular visits to your dentist at least every 6 months and excellent oral hygiene. 3. Use of fluorides while the teeth are developing and after they have come into the mouth. And 4. Sealants, little pieces of plastic bonded to the outside of the teeth. That's the topic of this video. What are sealants? Natural teeth have many grooves in them. Some are so deep they go right down inside the tooth. Some are so narrow that one bristle of a toothbrush is too wide to get in there and clean it. This is a picture of a tooth in cross-section with the nerve inside and the dentin and the enamel. You're looking at the top of the tooth and the groove that we just observed on the natural tooth. Can you see how food debris and bacteria can get down inside the tooth? And what happens then? Dental decay soon begins. As high as 1 out of 2 teeth will have decay in them 6 months after they erupt into the mouth. This is a groove in the top surface of a tooth, and watch that groove as it goes down inside the tooth. Decay can start very easily in there. In fact, in this case, it has started in there. Remember, this is the shape of a natural tooth, just the way it formed. And this is that same tooth with the grooves filled with plastic sealant. Advantages of sealants. There are several easily observable advantages to dental sealants. 1. The top of the tooth is sealed from entry of food debris, plaque, and bacteria. 2. The technique is relatively painless as the plastic is flowed onto the top of the tooth. 3. It's low cost. And 4. These are relatively long-lasting. Studies over 20-year periods show highly significant levels of sealants staying in place. And 5, importantly, there is no cutting on the top part of the tooth. Occasionally there will be a pit that goes so far in the dentist will have to clean it out, but usually there's no cutting on the tooth. Disadvantages and risks of sealants. There must be some disadvantages to dental sealant. A few teeth may be sealed that would not have become decayed. Obviously, we are sealing these before decay has started. 2. Cost. There's a small cost that we'll talk more about later. 3. A few teeth may require resealing after a few years of service because pieces of the sealant can be broken off when chewing hard objects. Sealants protect only the chewing surfaces of teeth, and good oral hygiene and fluoride therapy are necessary to protect the sides of the teeth. This drawing represents 3 teeth cut in half, showing the nerve or pulp, the dentin, and the enamel. You'll see that the top surfaces of the teeth are okay. They're protected by the sealant. The sides of the teeth still collect food debris and bacteria, and these can become decayed unless proper fluoride therapy and oral hygiene are carried out. Cost. The cost of placing one dental sealant on the chewing surface of one tooth is less than half the cost of a filling for that same area. Result of non-treatment. These are teeth that have had some fillings placed. If these had been sealed, these fillings probably would not have been necessary. The ones you see here have an average lifespan of about 15 years, and then they will have to be replaced. They're also unsightly. It's obvious that a white sealant is much more pleasing in appearance, and it does not require cutting of the natural tooth. By now the sealant concept should be quite clear to you. A small piece of plastic has been bonded onto the chewing surface of a natural tooth, thereby preventing food and bacteria from getting inside the tooth and causing decay. The sealant is also pleasing in appearance. It's hard to tell the difference between the sealant, which is here, and the natural tooth, which is here. They feel smooth to the patient's tongue and look just like a natural tooth. Sealants can be done in plain white plastic, which you see here, or can be matched to the color of the tooth, making it very hard to see the difference. Conclusion. Yes, sealants are an inexpensive, simple, painless, well-proven way to prevent dental decay on the chewing surfaces of your child's teeth. Remember earlier in this presentation when I talked about 4 methods to basically stop dental decay in your developing child. What were they? First, control the diet. Try to cut down on sugar and foods that will stick in these grooves. You're now more educated about how these grooves can retain debris. Second, the use of excellent oral hygiene and seeing your dentist and hygienist once every 6 months for cleaning and examination. Third, use of fluoride, which we have not talked about significantly in this presentation. You must have fluoride at the time the teeth are developing and also after the teeth have erupted into the mouth. And fourth, the subject of this presentation, place sealants on the teeth within 6 months after the time they have erupted into the mouth. I'm sure you as I would like to have our children decay-free. It's possible. It's up to you. I'm Dr. Stephen Christensen for Dental Health.
To learn more about dental health, subscribe to our channel. And for more information about your dental health, visit fordentalhealth.com.